Hey carnivores, welcome back to the channel. It's me, Bella the Steak and Butter Gal. I hope you all are having a meat-fueled good day as usual. Please do update me down below in the comments section on how you guys are doing on your carnivore journeys. You can also follow me on Instagram for more carnivore content, recipes, and videos featuring guests. In today's video, I interviewed Dr. Philip Ovadia. He is a board-certified cardiac surgeon and the founder of Ovadia Heart Health. After losing more than 100 pounds himself, he realized that the operations that he performs on his patients could be avoided naturally and without any medication. So keep watching to learn from Dr. Ovadia's experience and to hear his protocols to achieve optimal metabolic health and how to stay off the operating table. I also want to let you guys know that Dr. Ovadia will be one of my July guest speakers in my monthly 30-day carnivore challenges. Every month, I will feature a different panel of brilliant carnivore minds. The rest of the guest speakers will include Dr. Al Dannenberg, who I just interviewed. Please do check out the video with him. Rebecca Farmer, who I also interviewed. Sally Norton, who I also interviewed. I will link all of the videos down below in the description if you guys want to check out these guest speakers. And finally, Professor Bart Kay. By joining the challenge, you will have the opportunity to submit your questions for each of these guest speakers before the live Zoom Q&A happens. And I will be recording all of these live Zoom Q&As as well in case you cannot make them live. All playbacks are accessible to members only. In addition to these guest speaker calls, I also host 8 hours of live Zoom calls every single week to make sure that you guys stay on track. You will have opportunities to ask my team of coaches questions, to tweak, to troubleshoot with them, and also to connect with fellow community members. So to join the next challenge, feel free to go to the URL on the screen, sbgmeetup.com, or click the link down below in the description box to also read more about each challenge. Without further ado, let me invite on my guest, Dr. Philip Ovadia. Hello, Dr. Ovadia. How are you?
I'm doing great, Bella. It's so good to be here with you.
Your book, Stay Off My Operating Table, is now a big favorite among the carnivore community. But I would love to start off the conversation with what made you choose the path of being a heart surgeon, and what does a typical day of being a heart surgeon look like?
All right. Well, the second part of that question is that there really aren't typical days. I rarely know day to day, and especially I now practice heart surgery in a little bit of an unusual way in that I travel around the country. The days that I'm working as a heart surgeon, oftentimes, I'll be operating mostly in the mornings. And then, depending on the situation, sometimes I'm seeing patients in the office in the afternoon, or I have separate days when I see patients in the office. But one of the things that's unique about heart surgery, and maybe one of the things that attracted me to it, is that it can be unpredictable, and there are emergencies that come up any time of day or night. So you always have to be sort of prepared for that. I always knew I wanted to be a physician. And actually, when you ask my parents, they will tell you that from a very young age, I would say I wanted to be a surgeon. And I don't really even know that I knew what that was at that young age. But for whatever reason, it was something that stuck with me. And as I went through college and then medical school, I continued to have my passion for going into medicine, for helping people, and ultimately surgery, was the most interesting way, I think, for me to do that, the most direct way. I like the, combination of the technical skills that are involved, as well as the mental, I guess, part of it, the problem solving. Surgery in general, but heart surgery in particular, you never quite know what you're going to get into. And sometimes you have to be kind of creative to get the patient through difficult situations. And so that's why I continue to enjoy doing heart surgery. I feel blessed to be able to help the people that need it. But as you mentioned, as my book talks about, I would rather see a lot less people need my services as a heart surgeon. And so that's become another passion of mine.
Could you talk a little bit about how this became your mission now, about helping people avoid heart surgery?
Well, it really started with my own struggles. I struggled with obesity my entire life, and that was despite, following the mainstream advice and following, the food pyramid growing up. My family was very much in line with the guidelines. And then, as I got older, going through college and medical school and learning what we learn about nutrition in that setting, I, followed the advice. I tried to eat less, move more, eat according to the food pyramid and eating a low-fat diet. And it wasn't working for me. I was becoming progressively unhealthy. And I found myself at a spot about 7 years ago now where I was morbidly obese. I was pre-diabetic. And I kind of realized that I was going to end up on my own operating table, so to speak.
Wow.
And thankfully, at that time, I came across some alternative ideas around, why we get unhealthy, why we get obese. I was fortunate to be at a medical conference where Gary Taubes was the guest lecturer, and he had just written The Case Against Sugar at that time. And of course, prior to that, had written, Good Calories, Bad Calories, and Why We Get Fat. And his concepts made a lot of sense. And I tried them for myself at first, eliminating sugar and processed food and carbohydrates. And I was able to lose a lot of weight. And then I started asking why I had never heard this information before, why I had learned this from a journalist, and that's certainly no knock on Gary, but why didn't I learn this from my medical school professors? And then I came to realize, how these same concepts were intertwined with what really causes the disease that I was treating every day, heart disease, and how, the information that I was learning could help my patients not only recover better from surgery, but possibly avoid the need for surgery in the first place. And so I became, more and more curious about that, asked more and more questions. And ultimately, I came to realize that almost every time I am operating as a heart surgeon, it is because the healthcare system has failed that patient. And really, the need for heart surgery should be a lot less than it is. We all, of course, know that heart disease is the number one killer in the United States and worldwide, and has been that way for 40 plus years. And heart surgery, the types of surgeries that I do, are among the most common surgeries that are done, in the United States. And we really should be asking why that is.
So you have been cited as having 5 basic measurements for metabolic health. Could you talk a little bit about what they are?
Sure thing. First one is your waist circumference. So you can actually check this at home. And I advocate that people should be checking this. More predictive of health than your weight or your body mass index is. And so you just take a tape measure just above the level of your belly button. Best to measure it first thing in the morning. And if you are a woman, you want that to be less than 35 inches. If you were a man, you want it to be less than 40 inches. The next measurement is your blood pressure. Again, you get this checked every time you go to the doctor, but you can also check it at most pharmacies and grocery stores these days, or you can get a home blood pressure cuff. And you want your blood pressure to be less than 130/85 without the use of medications. So if you've been diagnosed with high blood pressure, that is already a sign that you are not in good metabolic health. And the final 3 measures come from some basic blood work. Again, these are things that I think people should be checking on a regular basis. Your fasting blood glucose level, so the amount of sugar that's in your blood when you haven't eaten for about 8 to 12 hours. And you want that number to be less than 100 milligrams per deciliters is the units here in the United States. And again, that needs to be without the use of medication. So if you've been diagnosed with type 2 diabetes and you've been put on medication to lower your blood sugar, another sign that you are not metabolically healthy. And finally, we look at the cholesterol panel. But what I always point out to people is that the one number on the cholesterol panel that most doctors focus on, the LDL cholesterol, so-called bad cholesterol, is not a measure of metabolic health. There are 2 other numbers that are on that panel. Your HDL cholesterol, the good cholesterol is its nickname. And as the nickname implies, you actually want more of this, which is always confusing to people. Specifically, if you are female, you want it to be over 50 milligrams per deciliter is the units. And if you are male, you want it to be over 40. Yeah. And finally, we look at the triglycerides, another, fatty acid that's measured, protein-bound fatty acid that's measured on the blood test. And you want that to be less than 150 milligrams per deciliter. Again, and that less is good. So you look at those 5 measures. If 3 or more of those are abnormal, you are officially diagnosed with what we call the metabolic syndrome. It's a medical diagnosis, and it means that you are at very high risk of developing things like diabetes, heart disease, many forms of cancer, Alzheimer's disease. All of these things have been associated with the metabolic syndrome. If you have 1 or 2 abnormal, it's a warning sign, because we know that people that have 1 or 2 abnormal today are likely to progress to the metabolic syndrome over the next 5 to 10 years. And if all 5 of those measures are within the healthy range that I outlined, congratulations, you are one of only 12% of adults in the United States that can meet all 5 measures of metabolic health. So shocking statistic, again, 88% of the adults in the United States do not meet all 5 measures of optimal metabolic health.
Wow. So in your book, you list in detail principles on how to have good metabolic health, how to stay off your operating table. So could you share a little bit about the biggest ones that's listed in your book?
Yeah. So the first one, I put it first because I think it's most important. It's sort of the overarching principle that you want to be viewing your health as a system, not as a goal. And what that means is that you don't want to be necessarily focused on just the short-term goals. Many people say, I want to lose 20 pounds. And when you focus on short-term goals, one of 2 things tends to happen. Either you meet that goal, you're able to lose the 20 pounds by doing whatever you do, and then you say, great, I did what I wanted to do, and you tend to slide back to your old habits. Or probably more commonly, you don't meet that goal. It's hard to lose 20 pounds, and you're doing this restrictive thing, and so you just give up and you sort of lose hope. And in the end, neither one gets you to a good spot. So instead, what I try and get people to do is focus on their overall health, focus on the system. I want to be metabolically healthy, and I am going to find the habits that promote my metabolic health. It's a more positive way to think. It's a more sustainable way to think. And I find that it leads people to more success. The next principle number 2, is eat whole, real food. And, there's all the debate in all the dietary camps, the vegans and the carnivores, the keto and the Mediterranean diet, the Atkins people, all of these things. When you look at what is common among people who are able to get good metabolic health, lose weight, improve, reverse their diabetes, reverse their high blood pressure, things like that, it comes down to eating whole, real food. And I explain that to people. I define it as the things that grow in the ground and the things that eat the things that grow in the ground. So these are your animal products. These are your plant products. I think depending on your preferences and your situation, there is some room for, how much of each you want to incorporate. But ultimately, the more that you eat whole, real food and the less that you eat processed food, the healthier you are going to be.
So when you say whole, real food, what if someone exclusively eats plant foods? So there's, as you know, a whole movement of eating whole foods, plant-based. So the vegan diet, vegetarian, but very healthy whole foods. I actually ate that myself for 6 years. So what are some things that you've seen with your patients? What are your thoughts on this diet?
Yeah, so I think that you can be metabolically healthy, on a vegan plant-based diet. You have to be careful about a few things. There are certain nutrients that are either impossible or very hard to get from plants alone. And so you have to account for that somehow. Supplements or, if you're not quite doing a full vegan diet, incorporating things like eggs can be very helpful because they have a good rounded nutritional profile. Getting enough protein from plants alone, again, can be a challenge, but it's doable. And then we also have to realize that, just because it says vegan on it doesn't mean it's healthy. A lot of the vegan foods are overly processed foods that are not supportive of good health. And, I give the same caution around the keto diet, for instance. A lot of the stuff in the supermarkets that's labeled keto is just processed junk food that's relabeled and, reformulated to fit within these sort of definitions, but they're not supporting your health any. So ultimately, I do know people who are successful and remain metabolically healthy on plant-based diets. It is more challenging. It takes more planning. If that's your choice, I do work with people, who are doing plant-based and are remaining metabolically healthy and, are keeping an eye on all the nutrients and stuff. So I'm supportive of that.
I personally tried to do it for 6 years, couldn't go on because I refuse to supplement. And I do think the vegan diet requires a lot of supplementation, especially if you want to have a cycle. If you're a female, you want to maintain good health. Most of the audience watching, they're carnivores. So carnivore, keto diet. And I'm sure a lot of them right now are wondering, what's a typical day of eating like for you?
I did go through a period where I was very strict carnivore for about 3 years, and then I've kind of migrated back a little bit. I do occasionally incorporate things like avocados and, I use some coconut oil. But for me, I typically eat once, maybe twice a day. That just, with the busy lifestyle of a surgeon, that has actually been a big plus and for me. And that's one of the reasons that I've stuck with the carnivore diet is because it's simple, it's easy. I'm not hungry a lot, so I only eat once or twice a day. And importantly, I do that because I'm only hungry once or twice a day. It's not a forcing myself to only eat once or twice a day. I eat a lot of red meat. I eat a lot of seafood. I eat a lot of eggs. Like I said, I occasionally will mix in, I'll have some avocado, maybe have some sauces or something that are not quite strict carnivore. But that's what it looks like for me. I tend not to be dogmatic. What I do with my patients, what I explain to my patients is just because this is what works for me, it doesn't mean it's what's going to work for you. I do truly believe that there isn't one right diet for everyone. And so, what I oftentimes end up doing with my patients is taking them through the exercise of figuring out what works best for them. And, depending on where you're starting from, where you are, where you want to be, I think there's going to be a different answer. But again, first and foremost, it starts with eating whole, real food.
So I'm curious to know what your colleagues think about your carnivore lifestyle, and what are the major skepticisms you face with them?
So obviously, being a heart surgeon and dealing with heart disease every day, I get the, red meat is bad for you. Cholesterol, the cholesterol issue comes up a lot. And quite frankly, I don't really care all that much about what my colleagues say. I care about my patients and the outcomes that my patients are getting. And so, I'm in the hospital when I'm dealing with, the patients who have ended up needing heart surgery. And, I may be having a discussion with the cardiologist about the low fat diet and the hyper focus on cholesterol. I simply point out to them that, that's the advice that these patients have been following, and yet they ended up on my operating table. So telling them to do that harder or do it better, it is not a sensible answer to me. I think we need to be open to these other ideas. I think we have plenty of evidence now that cholesterol, specifically LDL cholesterol, is not the end all and be all when it comes to heart disease. And so, insulin resistance, metabolic health is a much more powerful predictor of your risk of heart disease than elevated LDL cholesterol. And that's not even a debatable fact. It's been shown consistently in every study that's looked at it. So my focus with my patients is improve your metabolic health, improve your insulin resistance. The diet that happens to do that maybe raises your cholesterol a little bit, your LDL cholesterol level a little bit, I think that is a trade-off that we should be willing to take. Ultimately, my marker for success of a patient's way of eating is their metabolic health. And if it's improving their metabolic health, then that's a good way of eating for them. If it's not improving their metabolic health, that's not a good way of eating for them.
Do you find physicians and fellow experts in the medical field are aware that there is a natural way to improve insulin resistance to even reverse diabetes, or are they just following a specific protocol that they were taught to follow?
Yeah, sadly, the awareness of that is not what it should be in medicine. Now, more and more doctors are becoming aware of this, are getting clued into metabolic health. I go to the metabolic health meetings, the low carb meetings, and there are more and more physicians from more and more specialties there. Sadly, what I see all too often is that a physician personally will have used a low carb diet and seen great improvement, but they won't talk about it to their patients because they're concerned about, professional repercussions. And I think, that is very unfortunate. Again, I think we have more and more evidence that these dietary strategies are beneficial. We're getting more and more, community standards, I'll say, around it among the physicians, that practice this stuff. So there are guidelines and things that can help practitioners. So I hope that becomes less of an issue in the future. And I do see more and more physicians that are becoming aware of this and realize the power of it. But, again, we have very good data. Virta Health just released their 5-year data now. Previously, they had their 2-year data out there showing, 60% reversal of type 2 diabetes. At 5 years, the numbers are still above 50% reversal of type 2 diabetes. And what's unfortunate is that wasn't the front page New York Times, headline that it should be, because that is an amazing accomplishment. To be able to reverse a disease is always better than just trying to manage the disease.
So I'm curious if there are any circumstances that you can think of where medications like statins should be taken by a patient.
The best evidence for statins is in what we call secondary prevention. So these are people who have already had heart attacks or, a vascular event, and we're trying to prevent a second one. I guess the situation where I think maybe statins are beneficial is if patients aren't willing to make these changes, focused on metabolic health, and they're not, improving their hemoglobin A1Cs and reversing their diabetes and their insulin resistance, then yes, there probably is a small benefit to taking statins. The benefit is nowhere near what it's commonly thought to be or promoted to be by the pharmaceutical industry. The side effects of taking statins over long periods of time are very much underreported and underrecognized. But, if you're just not willing to, give up your processed food and stop, other habits that are unhealthy, then there probably is a small benefit to taking statins, and maybe it makes sense for you. But otherwise, I always try and get patients to realize the importance and the power of improving their metabolic health first and foremost.
I also wanted to add that if you're new to carnivore diet, keto, ketovore diet, or just low carb eating in general, and you're feeling symptoms like low energy, fatigue, mild headaches, or even worse, migraines, and you're just not sure why, it could be a common symptom of your body just adapting. So what really helps relieve these types of symptoms, especially muscle cramping as well, is electrolytes. And I really recommend Element electrolytes. They're extremely high quality. You know exactly what they put in their electrolyte products. It really is just sodium, potassium, and magnesium. And as you can see, they measure out each of the electrolytes. This is what the sample pack looks like. I highly recommend their raw unflavored, especially if you feel like you will be triggered by stevia, by anything sweet tasting. go with the raw unflavored because it is literally just the 3 electrolytes, nothing else. There's no stevia, there's no fillers, nothing artificial. You guys can get a free sample pack with any purchase with the URL on the screen. And I have also linked it down below in the description box, drinklmnt.com/SBGAL. What are your thoughts on exercise for improving heart health and metabolic health?
Exercise is useful. I always encourage patients to incorporate more activity into their day. 2 things that, I guess maybe are a little different than the standard messaging around exercise. I tell my patients, your goal, your primary goal for exercise should be to build and maintain muscle. We again have very good data that showing that as you age, the more that you are able to maintain muscle mass, the longer you will live and the better quality of life you will have. So I always tell patients to prioritize muscle building and muscle maintaining activities. So this is resistance exercise as opposed to cardio that we have been, told should be our priority around exercise. The other thing I try and get patients to recognize is that if you go to the gym and you do whatever for, 30 minutes, an hour a day, and then you spend the other 23 hours of your day just sitting around being inactive, you're not going to get any benefits from that. We need to get more activity throughout our day. So these are simple things like, after each meal, take a 10-minute walk. If you work in an office, get up every hour and walk around the office for 5 minutes, or even better, get outside and walk around for 5 or 10 minutes. Take the stairs instead of the elevator when you can. Using a stand-up desk, instead of sitting all day. Just simple things like this end up being more powerful than, that hour that most people go to the gym and just do their cardio. And then, unfortunately, a lot of people, they go to the gym, they do their cardio for the hour, they go to the smoothie bar at the gym and they take in a bunch of extra calories of processed food. And then they sit around the rest of the day and they're not active. And that's clearly not going to be beneficial to your health.
With your career, you have to stand hours and hours on end. I'm just curious, do you wear special shoes to prevent your feet from aching?
I don't, and actually one of the things that kind of led me to the carnivore diet was I did have a problem with plantar fasciitis that even on very low carb keto wasn't going away. And I started carnivore, not because of the plantar fasciitis, but I started carnivore and the plantar fasciitis went away for the first time in many, many years. And it has stayed away. And early on, if I would kind of stray off of carnivore, I would feel the pain in my foot again. Since being carnivore, which is now, coming up on 4 years for me, I don't have any problem standing for those long hours anymore. I used to get very sore. I used to get the back pain and the leg pain and all of that. Have certainly losing all of the weight that I did has helped. And, the low inflammation that comes with a whole real food diet helps as well.
And with the weight loss, you've lost 100 pounds, which is incredible. And a lot of people who come to carnivore, they are doing it for weight loss. Did you find that, tweaking macros or eating certain types of meats helped promote more weight loss for you?
Honestly, most of my weight loss occurred even before carnivore, doing just keto, low carb in general. And I think elimination of the carbohydrates, elimination of the processed food is the main thing there. Honestly, since I've gone carnivore, I really don't pay all that much attention to macros anymore. I'm just eating whole real food, mostly animal products. I eat when I'm hungry. I eat until I'm full. I've added muscle, certainly, with the increased protein that comes with a carnivore diet. And so I really don't pay all that much attention to the macros within carnivore. And I don't really think they're important for most people. I think, just making that change, eliminating the processed food, eating whole real food is going to get most people to where their body ends up being. And the other thing, I think that's important to point out again is that weight is really not that good of a health metric for many reasons. It's metabolic health that I really focus people on. And, those 5 measures as a basis, and then, a couple of other things like your insulin level are, what really are important in terms of predicting future health problems and avoiding those health problems.
Is carnivore diet safe for a patient who has had a recent heart attack and or stent implant?
We have to realize that the carnivore diet is not a fad diet. It's not a new diet. It's basically what we have been eating as humans for millions of years. So for me, the proper question to ask is the food pyramid, is a diet that is heavy in processed food, which is what a low-fat diet that's typically recommended for patients with heart disease, is that a safe diet to be eating when you just had a heart attack or just had a stent implanted? And quite frankly, I think the answer to that is no. And carnivore, whole, real food, low carbohydrate, low processed food diets should be our default diet. And I see no reason not to recommend it to patients who, have had a heart attack recently or had heart surgery or had a stent implanted.
And next question, what are your thoughts on stents? Are there any downsides to them? And is the heart able to heal itself over time when one is eating zero carb in lieu of using stents?
Stents have been shown, the main benefit of stents have been shown when you have a heart attack or you are having low blood flow to an area of your heart, what we call ischemia, and you are having symptoms related to that, and you have a significant blockage. Stents have been shown to be beneficial in that situation. Stents are oftentimes overused in patients who are not having active symptoms. The medical term for it is what we call stable angina, or not having angina, not having chest pains at all. Certainly in the past, and there is a focus on this within the cardiology community, not to overuse stents in those situations. Can you undo blockages that have occurred in your heart? Can the heart basically repair itself if you suffered a heart attack and have an area that is damaged? These are both somewhat controversial questions. What I tell my patients who are coming to me, for metabolic health advice, and they have heart disease, but not advanced heart disease that they need surgery or stents or anything like that. I always tell people that our goal is just to stop the progression, not to build up more blockages in the arteries of your heart. I have had patients who have reversed some of their blockages as measured by coronary artery calcium scores. Again, that's controversial. Many people will say that doesn't happen, but I have seen it in my patients. Many other physicians have reported it in their patients. So I do think it's possible, but I also tell people that as long as you stop the progression, you're going to end up, in a better place, and you're going to lower your risk of having problems from those blockages in the future.
What ways can patients with known heart disease improve their metabolic health?
The answer is no different for patients with heart disease or without heart disease on how to improve your metabolic health. And it's all the things we've been talking about, eating whole, real food, eliminating processed food, getting good amounts of activity throughout your day, lowering, dealing better with your stress is the way I always term it. We oftentimes can't eliminate stress, but we can find better ways to deal with it. Getting, adequate sleep, getting adequate sunlight. These are all the things that improve our metabolic health, and doing so, whether or not you have heart disease, really isn't any different.
And what things do you practice to deal with stress better?
I just try and be more mindful about it. And when I am getting stressed, I just try and do some deep breathing and relaxation. I don't really do formal meditation or anything like that, but for people who do, I think that's a great way to deal with it. One of the things that I have noticed in myself and I notice in my patients is as your metabolic health improves, you have a better stress response. You tend to be calmer. When your blood sugar isn't going up and down constantly on the roller coaster throughout the day, that just stabilizes, you mentally. And so I've just found, honestly, that as I've improved my metabolic health, I've gotten less stressed, or, I guess you could say I deal better with the stress. I still have the same amount of stress in my life. I'm still a busy heart surgeon with a family and running, multiple businesses. But I just seem to be able to deal with that better. And my patients find the same as well.
And I find the same too. That's awesome. What is the best way for a patient to approach their doctor to get on board if they want to come off statins or avoid statins?
So I think the discussion really needs to be, why am I on these medications? And honestly, this doesn't only apply to statins. When we look at things like high blood pressure medications and type 2 diabetes with glucose lowering medications, you should always be asking your doctor, why am I on these? What are the benefits and what are the potential harms? And are there alternatives to taking the medications? And the reality is that in almost every situation, there are alternatives. And, I think every doctor's goal, every patient's goal should be to not need medications. But unfortunately, that's not the way our healthcare system has evolved. That's not the way that most doctors are educated. And the healthcare system sort of traps doctors into being overly reliant on medications. So I think ultimately you start to have that discussion with your doctor. If your doctor can't answer those questions, like can't give you the numbers as to what benefit you should expect from this medication and what the risks of being on the medication are. And all they say is, well, the guidelines say you should be on this medication because, this lab number is X. Then, it might be time to find another physician, because quite frankly, I think that is I don't think that's being a good physician. And I think physicians should be demanding better of themselves. And I think patients should be demanding better of their physicians.
So you talked about CAC scores. What do you consider to be a high score?
I think anything over 0 is a high score. It's just a matter of, how concerned you need to be. In general, it's going to depend a lot on age. It's going to depend a lot on other factors, such as, do you have other risk factors for progression of heart disease? If I see someone who has gotten a CAC scan when they're 30 years old and their score is 10 or 20 or 30, I'm going to be concerned, because I know the natural history over the next 40 years is, that there's going to be progression of that. Whereas a score of 30 in a 70-year-old may not concern me as much. So I think the CAC score is one part of the equation. I think change in CAC score over time is another important part of the equation. But in general, if that number is more than 0, what it tells me is that you are doing something, that is causing plaque to start to form in your body. And we need to, get on top of that. We need to make sure it doesn't progress. And it's just a warning sign, anything over 0. Now, the other caveat is 0 isn't, always the end all and be all guarantee. Again, if you're 30 years old and you have a score of 0, that's reassuring, but it doesn't mean you can just do whatever you want for the rest of your life. Right. You have to make sure it stays 0, and you probably, need to be checking it more frequently than if you're 70 years old and you get a 0. The statistics show that you have a very, very low risk of heart disease over the next 10 years. So like everything else, the CAC score always needs to be interpreted in the context and as part of the overall picture for each patient. But, in general, anything more than 0 is something to be concerned about.
So a lot of people believe that the CAC score cannot be improved. Have you seen anyone improve their CAC score all the way back down to 0?
No, I've never seen anyone go from, a high number to 0. But I do see people improve their scores. And so, we kind of touched on it a little bit before. The natural progression of CAC scores, we know, is that they will increase about 10 to 20% per year. So we also know that if your score increases by less than that, so if it stays the same year over year, or it only goes up a couple of percent year over year, we know that puts you back into a low risk category. Whether or not, reversal, lowering of the CAC reliably happens, as I said, there's still some debate about it. I have seen it in my patients. Other doctors have seen it in their patients. But, as long as your score isn't progressing, I tell people, that means that you are remaining at a lower risk of heart disease than the standard, which is progressing 10 to 20% per year.
Genetics and metabolic disease. Is there really a predisposition, or could it be the generations of poor nutrition within the same family?
So I think that genetics actually play a fairly small part in all of this. We tend to put more weight on genetics because, families tend to have the same habits, and those things do get passed down, in terms of what we eat and things like smoking and activity and all of that. But ultimately what I tell people is genetics maybe define a range that you're going to exist within, but your habits are going to then determine where in that range you fall. And the habits of metabolic health are always going to improve no matter what your genetic situation is. And for the vast majority of heart disease that I see, I don't think it's really related all that much to genetics. Of course, there are some purely genetic conditions that do occur, but when it comes to metabolic health, I think genetics play a very small part in it. And I think everyone can improve their metabolic health by adopting the habits that we've been talking about.
Are there benefits for heart patients to water fast?
When you get into things like water fasting, especially for extended periods of time, which is anything probably more than 24 hours or so, you really want to be working with a practitioner who's knowledgeable about that and can help you with that. It's not that fasting is good or bad. Like everything else, it's sort of the context that it's done within. And it's a tool that can certainly help people to improve their metabolic health. But I'm not a big fan of people just, going on these long fasts sort of on their own. I think that's something, especially if you have an underlying condition like heart disease, like diabetes, you really need to be working with a practitioner who's knowledgeable about that to help you through that process.
And I will wrap up with this last question. I really love how you say that this diet is not another fad diet. It's more of a lifestyle for optimal health long term. So for our viewers who are watching who are new to this whole low carb diet, and they just find it so difficult to stick to it, they can't make the habits stick and seal. What are your best words of advice?
My best words of advice is you got to figure out your why. You got to, have that conversation with yourself as to why am I doing this? What am I trying to accomplish with whatever changes you are making? And ultimately, if you come to that true why, you're going to realize, that the why is more important than the food that you think you're missing. You also have to realize that processed food is addictive. Sugar is addictive. And as with any other addictive substance, there is a withdrawal period. And, you sort of just have to power through that. But again, working with a practitioner who's knowledgeable about this stuff can make that transition easier. There are certainly lots of tips and tricks that I use with my patients. I give my patients to help them through that transition period. But like detoxing from any drug, there's a little bit of grit, I guess, involved in it. And that's where the why comes in, because if you have that why, if you know why you were doing it, that's what's going to allow you to get through that difficult period.
And Dr. Ovadia, I do want to give you a chance to share where people can find you. I will definitely link his book down below in the description, but any special announcements you want to share with us?
I encourage people to go to ifixhearts.co. That is my metabolic health assessment tool. That it marches you through those 5 criteria that we talked about. You put in your numbers, it tells you whether or not you're metabolically healthy and what you should be doing from there. If anyone's interested in working with me, I do see patients throughout the United States by telemedicine at ovadiahearthealth.com. That's my telemedicine practice. So if you're interested in that, I encourage people to go there.
All linked down below. Thank you so much for your time, Dr. Ovadia.
Oh, thank you, Bella. This has been a great conversation.
I do hope you guys enjoyed this conversation with Dr. Ovadia. Please feel free to share this video with your family, friends, and coworkers to really spread the word about the importance of metabolic health and how we can do it naturally with the carnivore diet. Also, don't forget to hit like and subscribe and follow me on Instagram for even more carnivore content and videos with fellow guests. If you would like to learn more from Dr. Ovadia and have the chance to ask him your personal questions, he will be a guest speaker in my next challenge. The July 30-day challenge will include Dr. Ovadia, Dr. Al Dannenberg, Professor Bart Kay, Sally K. Norton, and Rebecca Farmer. By becoming a challenger, you will have access to every single guest speaker Q&A. You will be able to submit your questions for each of these guest speakers ahead of time, and you can also access the playbacks to each of these guest speaker calls. In addition to the guest speaker Q&As, you'll also have access to 32 hours total of live Zoom calls throughout the month. I host these meetings alongside my excellent team of carnivore coaches. Shout out to Coach Steven, Coach Raymond, Coach Adek, Coach Emily, and Coach Cherish. Our job is to make sure that you stay on track, get to your goals, and feel amazing. So if you're interested in the carnivore diet, you're new, experienced, coming back to this lifestyle, the 30-day carnivore challenge is going to be perfect for you because you will get plenty of support, guidance, troubleshooting from the coaches, and inspiration from each panel of guest speakers. If you have any questions at all, you can shoot me a DM on Instagram or email me. You can also go to sbgmeetup.com to read more details and see the schedule and to directly sign up. Thank you so much for watching, and I'll see you guys in my next video. Have a good day.